Welcome to Season 2 of Healing the Tigress, a podcast of conversations and stories on Asian American Pacific Islander maternal mental health. We are your hosts, Peggy, a perinatal mental health therapist,
and Jasmine, a clinical pharmacist who is perinatal mental health certified. As Taiwanese American mothers who lived through postpartum depression and anxiety, we felt like we didn't hear about other AAPI mothers struggling with their mental health in new motherhood. But we knew it couldn't just be us.
So we created this podcast because we hope that sharing these stories can start to break the stigma of mental health in our community and help heal the inner tigress in all AAPI parents.
Welcome back, everyone. Our guest today is someone that I've been wanting to bring on our show for a while, ever since I heard her speak about her story at a PSI virtual event. So please help me welcome Jigyna Patel, a South Asian mom of 3 girls living in Houston, Texas. Her perinatal story over the span of 10 years includes many different layers. There's the cultural stigma of that South Asian moms feel. There's the struggle of having a surprise twin pregnancy, being undiagnosed with postpartum psychosis, and having fertility issues while having PCOS.
Jigyna has a degree from the University of Houston with a bachelor's in communications, and she recently got her PMH-C. Woohoo! Her career background is in public relations and event planning, but after her experience with postpartum depression, postpartum anxiety, and postpartum psychosis, she changed her career path and life's purpose after she started volunteering with PSI in 2021. Jigyna, thank you so much for coming on our podcast and also for being a listener. Would you please tell our listeners about your cultural background and what you're currently doing within PSI for volunteering?
Thank you so much. I'm so happy to be here. I love your podcast and I'm so glad you guys are doing this. So thank you for being there for the South Asian moms. So I am from India. I was born there and I migrated here with my family when I was 3 years old. So I identify South Asian, Indian, and American because I've been here for pretty much my whole life. I am a mother of 3, like you guys said. And right now I am doing multiple things. And it all started back in 2021, 22, when I first discovered PSI. My postpartum story started in 2014, but I did not know about PSI or the myriad of resources that are available. And I only learned about them after I had my twins. And since then, I got in touch with PSI to join a support group for myself. And after I did that, they were like looking for more support group facilitators. So I said, hey, I think I'm in a good space. I've been healing from a second bout of postpartum depression. And so I wanted to volunteer. And so for the last 3 years, I am a PSI support group facilitator, peer mentor. I'm part of the PSI Postpartum Psychosis Task Force. And I'm also a local Houston support coordinator where I directly work with moms who contact the helpline. And through that journey, I learned about the perinatal mental health certificate. And so it was a 1.5 year long journey of trainings and figuring out how to get scholarships for it and taking the exam. I haven't taken an exam in over 10 years, and I was so excited to pass it. This is a whole new world for me. This career stemmed from a passion and a purpose. And when I got that certification, it just kind of made me realize that I'm in the right place. And then recently, I just joined an organization called the Policy Center. It's a nonprofit that works with different types of policies to kind of push forward the cause of maternal mental health. And I met the CEO at a couple of virtual events and we got to talking, and she is starting a new project where she wants to bring in community health workers into OB settings to help the medical clinics and OBs work with new moms, because hospitals and clinics and OBs don't have the manpower and the finances to support new moms. And so it's a whole new project with the Policy Center that I've, just got on board as a project manager part-time. So all of this that has happened to me has led me to where I'm at right now. And it's been quite a journey. So I'm really happy to be here. And thank you guys for having me.
Wow, that is such a resume that has all stemmed from postpartum. Like we often say, like, this is almost like a rebirth and you like rediscover yourself and it leads to different things that you never thought you'd be doing. So as much as we'd never wish anyone to go through what we went through. It's definitely shaped us. And, you're doing amazing things out there to help other moms, which is so cool. So I want to dive a little bit into your story and sort of peel back some of these layers because you had a lot of things going on. So as I listened to parts of your story and read about it, I hear so many factors that stand out to me as potential risk factors for postpartum depression. And I want to break down the experiences you had because we know a lot of things, anxiety, depression, and the psychosis, which we'll dive into deeper. But let's focus first on the pregnancy and birth, because you said, you have PCOS. And so you had to use fertility treatments to get pregnant both times. And infertility is already one risk factor. So then you had a traumatic birth experience with your first child. That's another risk factor, right? And then you mentioned that you didn't sleep for almost a month after you had your daughter. So the first child, which is a major, major risk factor. Sleep is so important. Did you notice any symptoms starting in pregnancy already with the risk factor of infertility leading up to the pregnancy and birth?
I would say that I knew that I was anxious throughout the pregnancy. I knew that I got diagnosed with PCOS after trying for 1 year to get pregnant. I mean, I got married in 2008, started trying in 2010, 11. It wasn't until 2012 that I had switched to a second OB, and she was like, are you getting your period? Are you ovulating? I'm like, no, how do I check my ovulation? And no, I don't get my period. It's been irregular for years. She's like, okay, let's do some tests and PCOS. I had no idea until at that time, and I had probably had it for many years. And so throughout and then the infertility journey, just one thing after another, the different types of testing, the different types of doctors, finding out how to ovulate, how to check ovulation, all of it was just nerve-wracking and stress building. And so when I did get pregnant, the whole pregnancy, I was anxious. I was stressed out. I couldn't believe that we had spent 2.5 years trying to figure all of this out. Why had nobody told me before? Doctors and OBs should know all this. And I had enlisted my whole trust in them. And so I had that, but while I was experiencing that in my pregnancy, I didn't think of it as a risk factor, that would affect my postpartum. Did I tell my OB? Yes. Did I tell my GP? Yes, that I was anxious and I can't believe what I've been through these last 2 years. Did they say anything to me? No. I wish that maybe they had the training, the knowledge to say, hey, I think you should, look into getting a therapist or talking to somebody, just start some conversation. But nobody did.
I kind of can understand some of that because same here that it took me over a year and we had seen all the doctors, and once you're pregnant, there is that anxiety and fear, gosh, I'm finally pregnant. Let's make sure this works and is smooth and goes through because we've already spent so much tears and brain power and just kind of manifesting this to happen. So yeah, I think people tend to forget that infertility can be a risk factor. So, but then you didn't really experience depression symptoms during that time. It was mostly sounds like anxiety a little bit during the pregnancy. Yeah.
Yeah. My birth, the whole last month was right before I delivered. I had stopped feeling my baby. And so that whole last month, I was very stressed out and I was worried. And my OB kept saying, you're fine. You're right along where you should be. It's fine. It's fine. And then, we went in for a scheduled induction. And then during the process of the induction, while they're checking the heartbeat and, hooking me to all the monitors, that's when they discovered her heart rate was dropping really fast. And so everything happened so quickly where, they said, forget the induction. We're going to have to do an emergency C-section. And they weren't telling me anything. They were telling my husband everything. And I was just seeing people run around, doctors and nurses, and seeing my husband's face just change the color of his skin. And, I was just like, nobody's telling me anything. What's going on? They're like, you're fine. Everything's fine. And then they're like, okay, we have to perform an emergency C-section. They still didn't tell me about the heart rate. And after that, anesthesia did not kick in. And that birth, to this day gives me chills how I felt the tugging and the pulling. And I felt each and every part of the surgery. And I was crying the whole time. had not expected this. I had gone to pre-pregnancy classes where I saw videos about vaginal births and C-sections. And I was like, okay, all of this is fine. And, but an emergency C-section and being told that you would feel it all, never thought of it, never heard of it, never read about it. And then the pain. And then going straight from that to having the baby and like feeling immediate fear and confusion and unknown and not knowing like what just happened. And then I'm being told that her heart rate had dropped to 0 and she almost didn't make it. And I'm like, is this really happening to me? And this whole time, nobody has come in from a maternal mental standpoint to check on me or a psychiatric standpoint. And I'm just being told stories and being checked on, physically. And that just birth stayed with me. And I tell a story many times about how my birthday and my daughter's birthday is 2 days apart. So I had sent a picture to my best friend. My husband had taken me out for lunch and I sent a picture to her. And so she came to see me the day I delivered and she's like showing me the picture and she's looking at me and she's like, this and you is 2 days away, but you look like 10 years older. She's like, what happened? And I'm like crying and telling her about the birth. And again, like all of this just added. And I just kept replaying what happened. Why did it happen? Why did nobody tell me? What were the signs that were missed? The whole month of my last pregnancy, I didn't really feel her move and kick. That was something, and that led me to just funnel into depression and anxiety and start not sleeping.
Mm-hmm. Yeah. I mean, the not sleeping part is huge. And sometimes it's like chicken and the egg. What came first, depression or the sleep problems, right? Because you're constantly replaying it, maybe your brain is overactive. It can be hard to sleep. And then it just vicious cycles. So when people say, though, like that they did not sleep, right? Can you break it down, actually, what that really meant for you? Because when I try to describe to people about my postpartum insomnia and how like I could not sleep for 2 or 3 days straight, even though I was trying like 1,000% to fall asleep for those 2 to 3 days. Like, I don't think they really understand the gravity of it and how it felt. So I'm curious, like your experience for that first month postpartum, like what do you mean by that?
So day would turn into night and I would literally just be awake. I would have 30 minutes here and there, but we all know, on a medical standpoint, you need like 4 straight hours of sleep to call it, that you're actually sleeping. And I would literally do what I had to do throughout the day. I would never nap when the baby napped. Nighttime would come. I would put her to bed. And at 9 p.m., 10 p.m. and on, all the way till 5 a.m., I would just be awake. Wasn't even her feeding time. She would be sleeping. Everybody would be resting and I would just be awake. And I, would be tossing and turning, then started the crying and then started the anxiety. When the anxiety would kick in every morning at 3 or 4 a.m., it was actual panic attacks because I would realize I'm still awake. And I got into my bed at 9 or 10 p.m. It's already 3, 4 a.m. I woke up with massive physical pain, heart rate and the chest pain, all of it that you've heard about, like when you have an actual panic attack every morning for 30 days. And it would take me almost 2 hours. I couldn't breathe. I'd be like huffing and puffing, like at 5 a.m. and not knowing what that was or why that was. And it was, the buildup of not sleeping and among other things. And the other thing was I started to have hallucinations and delusions after 2-3 weeks because I wasn't sleeping. And at the time, I didn't know it was psychosis in 2014. At the time, I thought I was losing my mind, but I just thought, okay, this is really scary. And I didn't even know it was because of the lack of sleep. At least for me, it was all step by step by step. And with sleep, I tried it all. I would try to, do body scan, meditation, count sheep, you name it. I would try it all. And it, the first week I did this, second week I did this, third week that, and none of it worked. And you start to lose, I started to lose my speech. I started to stop seeing things in color some days. These were all psychotic breaks. and all hallucinations that I was having due to the lack of sleep that developed into psychosis. And I had no idea what was happening and what the terms were, what the words for. I just thought I was going crazy. And I knew I was depressed. I was also crying day in and day out. And I knew I was anxious. I knew I was having the panic attacks, but I couldn't place it all together that it was happening because of this or that, or it was all combined.
Did any doctor know about it?
So no, that was what happened. As I was feeling all this, I wasn't really sharing with anybody besides my husband, one or two good friends, my mom-in-law who were helping me with my baby. And I went in for, the OB check, and I just told her that I had this birth and it was this bad. I think we go in at 2 weeks postpartum. And I told her about the birth and how, that's all I can think about. And because that's all I would focus on. The fact that I wasn't sleeping and I was having panic attacks, I wasn't really telling any professionals about it because I was just focused on the birth and what happened. And then I started to, tell the pediatrician that, I don't feel comfortable taking care of my baby and I'm just not fully with it. And I'm really sad and upset and I'm, just crying a lot and I don't know when I'm going to get out of this. So I said stuff like that, but never that, hey, I haven't slept, Yeah.
And when you mention some of the other symptoms that are what I'd like to call like typical symptoms of psychosis, like the hallucinations and delusions, those weren't things that you were bringing up with providers either, it sounds like. And I think oftentimes so many new moms are scared to say, what can I share with a provider that isn't going to freak them out and make them take my baby away or something? And oftentimes especially with the PMHD, they're trained like to ask questions that are non-judgmental, like saying things like, it's common to have intrusive thoughts. Are you having them? But this is different than an intrusive thought. The hallucinations are literally your reality, and your ability to see reality has changed. And delusions are like your thoughts. Your thoughts have become a different reality. Can you tell us a little bit more about what that was like and how that is different than intrusive thoughts?
Yeah. And, I think that I didn't even know these terms in 2014 when I learned the word intrusive thought and the word, postpartum psychosis. I learned them 3 years ago, and at that time I had no idea that they were all different and separate, but all combining together. For me, like, for example, like I had a hallucination that I was driving and my car was going off the freeway as I was driving. And at the time that it was happening, it felt so real. It felt like it happened. But I was driving the whole time. And I had to call my sister and she had to talk me to, not get on the freeway. I was not even on the freeway. I was on a local road, and to turn back around and go home. I would have like actual delusions that I was in my room doing nighttime feedings and with my baby, like going up and down the hall in my room and hitting her head against my 4-poster bed. And I would be holding on to her and I would see me doing it. And then I would feel me holding her. So I knew right then and there that this was more than just intrusive thoughts. At the time, I didn't even know that was what the word was, but I knew that I was out of my reality. I was having some sort of episode, and every time these things happened, again, I didn't feel comfortable sharing. I was afraid of, being labeled and judged or, being separated from my baby. I didn't even know that postpartum illnesses could instill these kinds of symptoms. I thought it was black and white, simple as postpartum depression and anxiety. Did not know there were more and how they were normal and part of so many women's and people's experience, and how there was help for it and how there was treatment for it. I just thought it was just me and I better be quiet because this could land me somewhere where I would be scared to go.
Yeah. And I think with that too is the impact your lack of sleep was fueling a lot of it, because if your brain is not getting the rest it needs, reality is going to feel warped. And so Hallucinations oftentimes can be visual, auditory. Delusions are beliefs that are outside of reality. So beliefs that, did this happen? Is this going to happen? That's how we know that this is not just an anxiety attack or an intrusive thought of like, oh, I'm so worried that I'm going to drop my baby if I go down the stairs. That's a common intrusive thought that a lot of moms have when it's teetering on the side of this is not the actual reality. That's the sign. And it's scary because nobody talks to you about that when you're pregnant. And of course, as moms, we tend to internalize, is this my fault? Like, why am I thinking this? And so there's judgment attached to it. So of course, we're going to think, is a provider going to judge us? And in an ideal world with all the PMHC professionals out there, no, I would hope that people are having safe places to do that. But I can understand why that would have been really hard to bring up these really scary images to someone when you don't know how they're going to respond or what help you can get for it.
Yeah. So now, like with PSI, the last 3 years, they have brochures and handouts, and on their website, they list all the different mental health conditions, right? Back then, when I finally got the help, I was just told about PPD continuously.
Mm-hmm.
If just somewhere I had received the handout or the PSI website or the brochure that PSI has, where they talk about all the different mental health conditions, I would have been like, oh my God. And I could have started my journey then, but I didn't know and didn't receive that information at the time. I learned about it literally 3 years ago.
I also kind of like hearing some of these details because it kind of highlights that delusions and hallucinations and things do not have to be like so extreme too.
Mm-hmm.
I think people think of the sensationalized versions of it. They could be very simple things as just like thinking you're seeing something that's not actually there, right? Or like you were saying, like you would start seeing just no color. Or like the hearing things, like hearing cries maybe that weren't actually there, right? So it doesn't have to be like really like wild sort of things. It could be little things. At the same time, like I hear also other postpartum psychosis survivors saying about like how the thoughts are just very bizarre, like it's very warped, right? And there's this whole thing about like ego dystonic versus ego syntonic. But at the same time, like some people are like, oh, if your thoughts scare you, then that's not a bad, then you're okay. But like your hallucinations could scare you too. I think there's a distinction, right? Like, so it really takes a person who is trained, I think, to sort of tease that out and ask the right questions that sort of lead to like, tell me more about what you're seeing or hearing or feeling, right? And so I want to bring that up because for most people, I don't want to like scare them into thinking like everyone's going to have this, but you need to be aware. People around you also need to be aware of what your baseline state is. So your supportive, family and loved ones around you need to be able to tell, like even like your friend who just said, you don't seem like yourself from just even 2 days ago. Like I can tell there's something off. And these are the important people around you in the postpartum vulnerable state that need to really be watching you and looking out for you and speaking up for you, because sometimes if you're in a delusional state or hallucinating, like maybe you don't even have the words to really define what's reality or not, and someone else around you has to be able to tell you, right?
Yes.
Yeah. So these are all great things I think we want to educate people about. And thank you for sharing this experience, because without survivors' experiences to rely on and to learn from, like it's hard to, like as a provider, I can't tell people like what to expect or not. But from a survivor's perspective, like this is so important to hear about.
Yeah. And I will say that another reason I think I kept a lot of my psychosis experiences to myself was because I was South Asian, because of the stigma that maternal mental health has in general, or mental health in general, that Indians and South Asians have. And then to top it off, I was never going to share my actual, episodes at the time, because I was feeling judged by my family and, my community for having just postpartum depression. I shouldn't say just, but having postpartum depression. And then to top it off, I would not dare at that time have spoken about it. And 3 years ago, when I learned I had it and I started to share this story more openly, I talked to my husband, I talked to my sisters. I'm like, please be ready because I'm finally coming out fully about what happened. And I shared the very first podcast I did with PSI with a lot of my close family and friends and cousins, and they just started messaging me. They're like, are you serious? You went through all of this in 2014? Why did we not know? Why did you not tell us? And my goodness, that you've lived with this for all these years. And I'm like, exactly. I didn't have the confidence and the trust with my family, my community. And let's be real, mental health is very much judged in our society, in my culture, in my society. And it took me years and many life experiences to realize that if I do this for no one else, then I do it for the new South Asian moms that I now meet, that I now have come to meet and to know, who are just starting their journey, and they are in the same place that I was. And so that's what I've been doing it for, is them. And little by little, it's been healing me. I never healed from 2014. I just now did. And I realized I never had, and that I needed to. And it was through getting the confidence and the guts to be like, I'm going to talk about this and let whoever wants to say anything in my South Asian community. So, like I said, the family and friends who I have shared my first podcast with, the story, they've been amazing about it. Some people have been a little bit like scared when they see me or approach me in real, because they're like, did that really happen to you? Like, wow. So it's been interesting. Now, over the last 3 years, like, everybody's warmed up to it and they're more curious. They're more like, tell us more. And then in the process, I've learned about postpartum psychosis, which to me, didn't even know it then. And these last 3 years, when I learned about it, what we talked about earlier, there are so many levels of postpartum psychosis. So I learned about it from a PSI webinar on psychosis. And when I saw that webinar, I heard 6 different stories, 6 different backgrounds, and these women, all different races and cultures, and they were sharing, and every single experience was different, but they all had postpartum psychosis. And then after that, when I started doing support groups for the moms in postpartum psychosis, so many moms were like me. Well, we didn't have any bizarre and out of this world experiences. We didn't have the religious tendencies. So we didn't feel like ours was as bad. And we didn't feel like we should share or get the help, because we all know how postpartum psychosis is in the news, and it's only been in the news in one theme, in one way, in the last many years. And so many moms were like, we know we have some of it, but we don't have it to that extreme. So then they felt like imposters. And I'm like, hey, I did too, but let me tell you, this is the definition. This is the diagnosis. These are your symptoms. You have it, and we deserve the same amount of help and treatment as anybody else who's had it on different levels. And right now on the PSI task force, postpartum psychosis task force, they're developing a discussion tool, and there's like 20 of us, and we're all giving input on each experience. And we're wanting to get everything on this discussion tool because we want women to know your psychosis experiences and episodes can range from here to here, and it all qualifies, and you all deserve the treatment and the help. So that's something else that I'm learning, that I don't want any mom to feel like she doesn't deserve it because it's not as bad, whether it's psychosis, depression, or anxiety, or any of them.
The thing that I think is so powerful about that is the ability to name what you're experiencing. Like, you weren't able to name it back then. So it became such a scary, just a lonely thing. But to be able to provide that resource for other moms to say, oh, this is what you're experiencing. There's a name for it and there's treatment for it. And this is something that we know about, and that you can bring it up to a safe provider and you have a name for it, versus not having any idea how to describe or explain what you're experiencing. I think that is what's really important about being able to put it in a category versus here's just this experience I'm having and it's scary and I feel alone in it. And now people don't have to be alone in it. People have the resource. And again, naming it. This is what I'm experiencing. And so I know that there's treatment for it.
Yes. Yeah. Having that, like becoming your own advocate, again, something I've been doing the last 3 years. And it's just, that's what I tell all my moms that I work with, that educate yourself, become your own advocate, and just know that everything that you're going through, somebody else has, which is good news because that means there's help, there's treatment. And the minute that you feel the confidence to be like, okay, this is what I possibly may have, or I'm confused, but I think, there is somebody out there who can relate to you, get you the right help. But it's just about kind of knowing these different things in the postpartum world that you will only know if you start to get the courage to speak up about it.
Mm-hmm. What I am hearing the theme of, and this is something I like to say too, is also that you don't have to suffer the hardest to get help. And your like you just said, the psychosis can range quite a bit. People go on to have fully functional lives. It doesn't mean your life is over either. I think that's another thing that you're showcasing here, is that like it can be episodic. Yours is probably very highly tied to that lack of sleep, because when you do not sleep, your brain is not right. So that's why we need to hear more of these stories, and that's why it's important to share these stories. And so thank you for, again, continuing to speak up about it and advocate about it, especially for our Asian American communities. Because like you said, it is just so stigmatized, and like you said, right? You're not sure how people are going to treat you afterwards, but you had to get it out there to heal. I think like sharing the stories is very important for your benefit too, for you to move on from it and grow from it. So yeah, I really appreciate all the things we're learning from you too. And I want to move from being aware of this happening. We've also learned in our PMH-C training that oftentimes providers are not always taking the responsibility to screen for postpartum depression. You said you saw multiple providers. Like, in your situation, it took like 2 months for somebody to diagnose you, is what you've told us. And interesting enough, it was your child's pediatrician and not your OB. So how did this come up with your child's pediatrician? And this is the depression part, right? Because she didn't catch the psychosis. But how did they ultimately diagnose you and, get you prescribed on medications, assuming the pediatrician can't really prescribe for you because you're not their patient? But how did it lead to your treatment?
So I was 2 months, postpartum, going and taking my baby for her 2-month visit. And the pediatrician had seen me, I'm sure, twice before that for the shocks and so forth. And she was like, okay, so how are you now at that 2-month visit? I'm like, still not well. I'm still not feeling good. I just barely started sleeping, and I'm not able to get out of bed, and I just don't. And so I was just telling her all this, and she's like, okay, I'm going to screen you for PPD. I'm like, okay. Okay, there's a screener. Great. All right, let's do this. And so she screened me, and she's like, all right. So, immediately she gave me my results, and she's like, I'm going to diagnose you with postpartum depression. And I'm going to give you a list of therapists, and you need to call one of these therapists and get in. And I think you may benefit from medication sooner than later. And with all the taboo of medication, there started that whole journey. I don't want to get on medication. And, oh my God, what is my family going to think? And, what is it going to do to me, side effects and so forth. And I had already stopped breastfeeding by then, so I wasn't worried about that. But I knew that was a thought as well, that what if I do want to start trying to breastfeed again? So, and in general, medication had such a bad label to it. And again, it was just my lack of knowledge, and nobody had ever cleared it up, or explained anything. But I went ahead and went to the therapist, and I didn't vibe with the therapist. I didn't really feel any connection. But she also said the same thing after doing the intake and hearing my story, that you need Zoloft or something similar, SSRI, to get your anxiety in control, and that possibly will help you with sleep, and that will help you with the depression. Like it all will like go roll into one thing. So I said, okay, fine, prescribe it. So she prescribed it, but I didn't take it for almost 3 or 4 weeks. And now we're into the 3rd month of having my baby. I had more hallucinations and delusions, and I had to be moved in with my family. My husband had gone back to work full time, and my mom was, coming back and forth an hour away to stay with me. And I couldn't be left alone with my child at that point. So I had to move in with my parents, and we, packed up, my baby and I, and left. And I'll never forget saying goodbye to my husband, because he stayed home because work was 10 minutes away, and he worked about 60 hours a week. And it was that week before I left that we went to a local Walgreens and filled the prescription. And I took it and went to my mom's. And I decided to start it. And it was purely because of the events that had transpired from the moment I started seeing the therapist to when I had the medicine. And so as soon as I got on Zoloft, the first 2 weeks were horrible. I've learned that's common. It took a while before I felt like it was doing anything. And then the third and fourth week, the panic attacks stopped. And at night, I was able to start sleeping. And then started that whole journey. And in the process, I changed to another therapist who I vibed a little bit better with, but both of them had never had any sort of PMADs. They had never helped any patients with different postpartum mental health issues. And so at the time, their main patients were just major depression. And I could tell the difference. Now I know, because now I know how it feels to have somebody who has been trained or has gone through it. And then it was the combination of the Zoloft and the therapy and the sleeping. And on the side, I was doing the meditating and the journaling and outdoor nature walks, you name it. I was doing it all. I mean, probably 8 different things worked to get me from 0 to 20 to 30 to 40 and 6 months later and a whole year later before I felt like myself.
Wow. Can I ask, were the therapists that you had also South Asian or Asian American or person of color?
No, they weren't. They were
Okay.
not. And that's the other risk factor that now when I talk to some of my moms who are people of color, I'm like, by the way, that's a risk factor that you are a person of color, depending on what area you live in, who your providers are. Are they trained in your, culture and all the different things that we're dealing with as people of color in terms of medical care and assistance? And when these women are like, what do you mean? I'm like, oh yeah, being a person of color in the medical world and getting the right and appropriate care is a risk factor in you developing some sort of possible maternal mental health condition. And so the pediatrician, she is Indian. And so it was ironic, didn't even like put 2 and 2 together at the time, but she's still actually my twin's pediatrician as well. So I've known her for over 10 years now. And I was telling her about like what I'm doing and what's going on. And so she started putting up flyers and brochures of PSI in her office the last few years. Yeah. And so I realized now that it's so important to find providers that look like you, possibly have gone through your experiences or have some sort of training and knowledge. And what community, what society are you in? Like, who are they serving? All of this matters,
I've had clients tell me too that they purposely seek me out because I'm a person of color, and that their experiences with providers that are a little different. And not to say that non-person of color provider is not qualified. There are so many cultural pieces, and they do come up in session. Like, all the cultural pieces really do come up, and there is no one size fits all. So many of these therapeutic modalities are developed in a very Western white world, and you do need to take into account the other pieces. It is so important to everyone's healing. So it's just so fascinating that the one person who was able to say, I need to diagnose you and I need to get you the help, was someone who was also South Asian.
I also feel like that medication piece where you were scared to take the medicine, had your therapist been maybe someone South Asian or person of color, might have been able to get through to you a little bit faster about why to take this medication. Because I think it's so easy for providers to be like, just take it. But like on the patient side, you're like, are they really going to take it? Like, I know this from my work with patients, like, and also sometimes patients just like say, a lot of also people of color will just be like, okay, yes, I'm going to do it. And then they don't actually go to do it later on. You check in a month later and like, you didn't pick it up, because they just want to like, okay, like I'm like people pleasing too, right? Like, yes, I'm deferring to the doctor. You're the doctor, you know best. I'm going to just like nod my head and say yes right now. I'm not actually going to do it because like, I'm kind of scared of this. So I think that might have been a missing piece too in you getting help a little bit sooner. So I'm glad somehow you internally worked over that stigma of just, you know what, at this point, I just need the help. and I'm going to try, just going to try it.
Yeah. I mean, I was Googling and calling friends and family that I had heard that, oh, maybe this person has taken some sort of medication for their sleep or their anxiety. And I was talking to, one or two of my cousins, much older than me, and they were like, yeah, we took that medicine for sleep and depression. And so it's okay. Just try it. I needed that to feel like, okay, I can do this. And every single step of the way, I was thinking about, I met so many different therapists, and how are they going to know that as a South Asian, there is so much stigma on medication, on getting therapy, and not even just the therapist, like my OB and my GP. And I had that one pediatrician, but it was a clinic with different doctors. And so I saw some other ones too, who were not providers of color. And how are they going to know all the particular setbacks that we have in being South Asian and being a person of color? And so that's something else that I'm seeing, and I'm learning that more providers are gaining the trainings and the knowledge for it, which is so important.
Mm-hmm. And I also wonder the domino effect of how it was never addressed, the traumatic birth. Like the traumatic birth was part of the catalyst, I think, also just the infertility, all the little dominoes, but that was never addressed. And it was what kind of peaked ultimately the sleep deprivation, insomnia. And had a provider said, let's process your traumatic birth. Let's talk about it. Let's help you be seen in what you experienced, how much that could have contributed to. And just these little pieces that, again, if you're not seeing a provider, like you said, those providers didn't have experience with perinatal mental health or anything. That's one of the big things that probably would have been really helpful as well. And so like not just finding a provider who has the cultural competency, but also this deep understanding of all the parts of the perinatal journey, which includes needing to process and heal from the traumatic birth.
Yeah. And to see the signs and symptoms and to start the conversation, to just ask the patient, okay, like how are you doing? How is this affecting you? But I have since learned that, OBs do not have, like I said, the bandwidth, the manpower, the budget to do all this. I had no idea. And I spent years just, blaming them, but it's more bigger than that. And that's another topic. So, and that's why the work that I'm now doing with the Policy Center is so exciting. And it's starting in California. Hopefully it'll come to Texas, bringing in peer support specialists or community health workers into an OB setting to do that work. And so the OB doesn't have to worry about it, but at least the patient's needs are being met in a whole circle, not just the physical aspect and the pregnancy aspect. And it starts with while the patient is pregnant. So it's an amazing program. And I hope it kind of just filters out all over.
Yeah, super exciting. I'm going to pivot us a bit because you have 3 kids now, right? And of the 3, 2 of them are twins. So after recovering from the first pregnancy, I imagine you decided you're ready to have a second child, even after having to heal from the postpartum depression, postpartum anxiety, postpartum psychosis. And so you did fertility treatments again. Tell us what you were thinking and feeling when you found out that you were having twins.
So I've been pretty open about my fertility journey. I did an IUI for the first one. And for many who don't know, it's the first step or the first approach before IVF. And then I did another IUI, and I got pregnant with my first one right away with just one IUI. And then we did another IUI in 2018, and I got pregnant again right away. We were just going for one more. And it had taken me 4 years to feel confident, ready, healed somewhat. And all right, let's do this. And when I found out that I got pregnant, I started Googling, how can an IUI produce a twin pregnancy? And the results and the statistics were so low. And it's like 1 in 1,000 chance that an IUI can produce a twin pregnancy. And I was just in deep shock. And I went into depression in that pregnancy right away. We were not wanting more than one. We were not ready mentally, financially. We didn't have a village like we did with my first one. And I knew what I went through after the first one, I don't know if I could do it again ×2 and really ×3. And so that whole pregnancy was just full of fear and stress and just, what do I do? How did this happen? So it was the first, and I had already told myself while we were trying to get pregnant the second time that I was going to have a postpartum plan, a birth plan and a postpartum plan. So I had called up one or two therapists. I had talked to my OB, my new OB, that this is what happened to me after my first one. I told my husband that I'm going to go directly to my mom's and live with her right after I created a whole plan. And then just having to find out that it was twins completely threw me off. But it also helped that, ironically, what I had gone through is what, helped me for my second postpartum experience to be shorter. It was about 4 months, not a year. And also that plan came in handy because I just focused on that plan and it got me through step by step with postpartum depression and anxiety the second time.
Jigyna, I feel like you are just scoring these 1 in 1,000 twin pregnancy for IUI. Postpartum psychosis, the statistic is 1 to 2 in 1,000 as well.
Right.
So you are just living evidence that it doesn't, like, it can affect anyone. Like, you just don't know. And no matter how hard you prepare sometimes, like, life will kind of throw you another wrench. But like you said, it was maybe that previous experience that saved you the second time. Like, it was preparing you for that because you knew going in, like, gosh, I gotta like extra prepare. And I know going forward. So then, you mentioned you had a postpartum plan. So that was what you did to prepare for this second pregnancy. My follow-up question is, did you take medications during the pregnancy? And actually, I guess, like, after the first one, did you stop the medication at some point and then pick it up again during the second pregnancy, postpartum?
The first time, I was only on it for 3 months. And once I started sleeping, I weaned myself off. And my therapist at the time was like, are you sure you're not having any major side effects? It's obviously helping. You're sleeping and the panic attacks and anxiety has gone down. And I was like, no, I think I'm ready to wean off. So I think I weaned off, and by 6 months I was off of it. And then I never went back on it. When I was pregnant with the twins, I considered it a lot, but I just told myself, you know what, I'll get the prescription and I'll fill it as and if when I need it. Because what happened is, during the pregnancy with the twins, I also started becoming like on this total, I guess, like grip of, I got to figure this out and I'm going to look into my postpartum plan. And I had a mission. And so I was so focused on like what's going to happen afterwards that each month just passed and passed and passed. And I told myself the medication is there and I know enough about it. I know how it will be. But I will say, being pregnant did hinder me to take it. I told myself I would wait and take it after. Now I know that it would have been totally fine and I would have been healthy. Babies would have been healthy if I had taken it while I was pregnant. But I did not have that knowledge then. And so luckily I had a therapist while I was pregnant, and I had the support of my husband and my family and my own postpartum plan mission that kept me going. And then after I delivered the twins, even though I had the plan, that's how it works, right? Postpartum depression, or depression in general, does not discriminate. You can be the most privileged and have all the plans and it can still hit you. And it did with me after the twins as well. But again, I just stayed focused on what I was aiming to do and what I had thought of. And I also think that that's when COVID hit. So my girls were like around 5 months and the world shut down and everybody was in the same place, stuck at home. So that kind of gave me some like feeling of, hey, we're all in this together. And the months just kind of passed by one. And I had, like I said, I would go see my therapist and she's like, prescription's there if you need it. But I didn't take it the second time.
Yeah. That is really telling, again, when people are scared, when they hear about these postpartum experiences, that they don't have to repeat themselves. They can be episodic. It sounds like you didn't actually experience postpartum psychosis the second time around, and you didn't need to take the medications the second time around. You had a therapist. And even though you're like, I still experienced postpartum depression, anxiety, maybe that postpartum plan and all the things that you put forth still helped decrease how the risk factors, right? Like it maybe still impacted it in a way where it didn't have to be like your first postpartum experience. And I think that's really helpful because some people might think, okay, if my first experience was this way, every experience of pregnancy postpartum is going to be this way. And it doesn't have to. Even with the wrench of surprise, you have twins, and it still was a, may I say, more positive postpartum experience compared to the first. And that just because you needed medications the first time doesn't necessarily mean you need it the second time. Could be a combination of all those things, the postpartum planning, more knowledge, more awareness, a better relationship with a therapist, or even just knowing, hey, if I need it, the medication's there.
Right.
Like a safety blanket, like feeling like I do have a backup plan because I knew it worked another time before. And I bet you planned for more sleep this time.
Yes. It was part of like the number one thing on the list. And again, something I didn't give importance to in 2014. And I think the other thing I decided when I was pregnant with the twins and after I had the twins was I was not going to let that inner voice of, hey, you are a mom and you have to have it all together and you better know that you can do this and you have to do this. All the things that affected me in 2014, along with, the anxiety and the lack of sleep, I lived with those voices and thoughts, and a lot of it because I'm South Asian and because I know that my mom and my mother-in-law and my sister, they didn't have the time to sleep and cry and be in bed, and they didn't have that luxury to go for a massage and go see a therapist, right? So all of that really kind of added to feeling depressed my first time around. The second time around, I told my family, I told my husband, I am going to be going for massages once a week. I will be going out for lunch once a week. And as soon as the babies are 2 weeks, I'm out of here. I knew those were the things that would help me because when I tried to do those in 2014, I got some judgment. I had my own inner voice, my own inner critic. Where did all this come from? How I was raised and what I didn't see happening in my own world, in my own family, in my own, my aunts and my moms and so forth. And so I told the family that the things that are important to me, that make me me, I'm not going to kill them and stop them just because I'm a mom. That was part of the reason that depression took on so heavily in 2014. And after I had the twins, I'm like, if that's one thing we can stop and control, let's do that together. And it does not make me a bad mom. It does not make me an underqualified mom. I thought all of that in 2014, but now I know better. We should know better. And so please. And then it was the first time in 2019 that I talked to my in-laws about, hey, you know what happened in 2014? That was postpartum depression. And at the time, I told you guys, but it was also anxiety and psychosis. And let me tell you how much it affected me. It really affected me for years. And now I cannot do this again with the twins and with 3 really. And so I made sure that I remembered that my South Asian upbringing had a lot to do with how hard I was on myself as a new mom after the first birth. And then I told myself and my family and my friends, we're not doing that part again. Let's make that a whole different experience. And so, I, lived my life side by side after I had the twins. And of course, like any, normal South Asian, I felt a little bit of guilt and, still do to this day. But I tell all of my friends we're all moms together that just remember that, have your identity and hold on to yourself as dearly and as equally as motherhood. Because for people of color, it will lead you to dark places if you don't.
What you're saying reminds me of Jen Che's episode From Head to Toe and how she's like, I choose what I let in, and that people are going to judge you. We're going to judge ourselves, but you have to be your greatest advocate. You have to be your greatest friend and love yourself. And I love that you're just like, look, I'm doing this. I'm doing this. I'm throwing the generational shame out the window. I'm going to take care of myself, because if I don't, I can't take care of my family either. And it's that self-advocacy, this confidence in being like, I'm in the driver's seat of my postpartum journey. I'm not going to let the naysayers or the generational trauma or my upbringing, the lies I've had to believe about myself, I'm not going to let it dictate, and you take control of the narrative that you are going to live through.
Yeah. Yeah. And for the longest time, I had an image of what a perfect mom is. And it comes from my own mom, and it also comes from how I see different women in my family, but then also from what I've been raised to watch in America on TV and the books that I read. And then over the years, I've learned that yes, they're all great moms, but whatever way that I choose or you choose or my friend chooses, it can all be different and it can all look different. But at the end of the day, every mother is going to love her child unconditionally, and that's all it is. That, and how we all choose to mother does not define us or make us bad moms or like underqualified. But it took a long time to learn and realize all of this, and it comes from a lot of it being South Asian. Yeah.
I was going to ask you what you would tell other moms, any words of advice, but I think you just perfectly summarized all of that. So I'm going to then ask you our closing question, which is you talking to yourself. Since we are called Healing the Tigress, we're working on healing ourselves, right? And it does sound like you've gone through this process and journey. So what would the Jigyna today, with all your experience under your belt and your self-advocacy and self-love, what would you say to yourself in your darkest and hardest time through your motherhood journey? Or even could be another part of your life, but what would you go back and tell yourself in order to heal her?
I think I would tell her that just hold on. Don't let go. Know that you are stronger than that moment, that day. And just hold on, because there's a lot more other challenging and turbulent times to come. And each one is just going to make you more strong and more like resilient. And also, I would tell her that in that moment, you may want to give up. Well, go ahead and give up. Go ahead and cry. Go ahead and sleep in. Go ahead and feel, because I kept fighting all of that. And I kept thinking that made me a bad person, a bad mom. But no, it's okay to feel all that and need to feel all that. And none of that equates to you as Jigyna or as a mom. It was an experience. It was a moment. It was an actual illness that you were living. You were sick, and that deserves to have its place. And just like you would treat anybody that's sick, you were meant to be treated. And I would tell her that don't undermine or not justify what you had. What you had was real, and that you deserve to get the time and the healing and the treatment that you need, and that you'll come out of it. And hopefully you'll see that it doesn't make you somebody less than.
Those are beautiful words.
Thank you.
There's this like viral trend going around right now about like I met my younger self for a cup of coffee, and what would you talk to her about or tell her about, knowing that you've already walked these shoes later on. And a lot of self-healing, I think, in looking back, reflecting back, and telling your previous self it's gonna be okay. And you're doing amazing things now. We are so excited for you and following your journey. Where can our listeners find more of you if they want to connect with you? Or maybe there's a mom out there that this has really touched her because maybe she's gone through something similar and she wants to connect. Is there anywhere people can find you or learn more about you?
So you can always email me. I'm very open about my email. You guys can share it in the show notes as well.
Okay.
Then I'm on Instagram. My handle is not coming to me, but I think it's Jigyna 525. All of a sudden, my handle's not coming to me. And then, I'm on Facebook as well, my first and last name. So I'm totally comfortable with anybody messaging me on any of these platforms.
Thank you. We will share that in our show notes.
Of course, thank you guys. And I want to applaud you guys for this amazing work. I totally want everybody to know that your show is so important to so many of us. And so good luck and keep doing this work.
Thank you.
Thank you so much. Thank you for tuning in to this episode of Healing the Tigress. The more we share these stories, the more we can help other AAPI mothers and partners. If you enjoyed this episode and would like to keep supporting this mission, please hit the subscribe button to the show and take a few seconds to leave a rating. An extra big thanks if you would also leave a review to boost our show visibility and help other AAPI folks find us.
You can also follow us on Instagram at Healing the Tigress, or even better, check out our Patreon at patreon.com/Healing the Tigress podcast to support us more. Inside the Patreon, we will be offering more bonus episodes, sneak peeks, and a community for you to help shape our podcast too. Thanks for being here.
Healing the Tigress is produced and edited by Peggy and Jasmine.
Music for this show is remixed by Dr. Tony Huynh of Tony Mixes.
Our intro music is a cover of You and Me by Z Avi, played by our co-host Peggy.
Our outro music is a cover of Green Island Serenade, played by Jasmine's sister.
Cover art design is by Dr. Angela Chung.